Swadikap and good afternoon, late afternoon actually today, Friday the 9th of July 2021, and this is the English language summary of the CCSA daily briefing. So first, apologies for the delay in the daily briefing that we had today. We have moved from 12:30, 1 p.m. to now, which is 4 p.m. Because of the CCSA general meeting that we had just now, and they were finalizing some of the details before being announced. First of all, I'd just like to mention that prior to this briefing, prior to 4 p.m., there had been a lot of news reports released into the public, which in actuality it had inaccurate information to some degree. There are a lot of details. There are a lot of details in the new measures, which I'll go through. But the reports that you have seen since early this afternoon, was not actually the official one. Perhaps it was a leak of some of the measures or information. I'll recap some of these just to be clear. First of all, I'd just like to say that in terms of the vaccines, we've administered already 11.9 million doses, wherein 8.8 million people have received their first dose, 3.17 million people are fully vaccinated, and only yesterday we had over 356,000 of vaccine doses vaccinated. The inoculation drive now has covered 38.9% of those residing in Bangkok, and for those and this is actually those who have received at least one dose, and the national inoculation coverage now stands at 12.2% of the entire population. Just in terms of the numbers, we still have high numbers for today. 9,276 as the daily record that we have latest. We have 3,928 new recoveries. Over 74,000 active cases. You see on screen 74,895 active cases, out of which 2,685 are in critical condition and 701 are on ventilators. We have 72 new fatalities, unfortunately. And for the overall situation, we have, of course, a list coming up for you. Bangkok still tops the area with the highest number of cases. Now, for the general CCSA meeting, which the Prime Minister chaired this morning, it discussed many new measures. The Health Ministry expressed concern that the numbers of infections are on upward trends, and we could possibly see the daily number of new cases exceed 10,000 per day very soon. It's around almost 10,000 today already, 9,200 plus. And the number of deaths could exceed 100 per day by the next 2 weeks. So therefore, with this situation at hand, the Prime Minister and the CCSA has decided to come up with impose new measures that are necessary to prevent further loss and save our healthcare system. Now, these measures, I'll run through those. It includes curfew as well as lockdown, but firstly on new zoning. Approved was the new color-coded disease control measures in terms of the provincial distribution. The dark red provinces, or maximum and strict controlled area, remain the same 10 provinces, which are Bangkok, Nakhon Pathom, Narathiwat, Nonthaburi, Pathum Thani, Pattani, Yala, Samut Prakan, Samut Sakhon, and Songkhla. So if you notice, it's mostly Bangkok and nearby provinces in the central region, as well as some provinces in southern Thailand. The provinces that are categorized as red zone or maximum control area has increased from 5 to 24 provinces. And the controlled area or orange zone increases from 9 to 25 provinces. And you see that on screen. Only 18 provinces on the lowest part of the chart here is the yellow zone or the surveillance area. So 18 provinces remain in that category. Each provincial authority will adjust and amend their disease control measures and regulations to comply with this new color-coded zoning. You see on screen now also the change that we have since June, since the 18th of June until starting on Monday, we'll reclassify this the 12th of July. So in each zone, the provinces may have been added on to it. For example, the maximum control, the red, is 5. Now it's 24 provinces. In terms of the new restrictions, I'll start first with the restrictions that are for the 6 provinces that are in the dark red zone. These 6 provinces, namely, are Bangkok, Nonthaburi, Pathum Thani, Nakhon Pathom, Samut Prakan, and Samut Sakhon, and you have that on screen. So from Monday, the 12th of July onwards, the restrictions will include the closure of shopping centers in these 6 provinces, starting on Monday, with the exception of supermarkets, takeout restaurants, banks, and financial institutions. And the restaurants, markets, and convenience stores, standalone ones, must be closed at 2000 hours, 8 p.m., and may resume service at 0400 hours or 4 a.m. Public transportation will stop their service from 9 p.m., 2100 hours, and resume service at 0300 hours or 3 a.m. Spas, beauty centers, and massage parlors will also be closed, and public parks will be closed at 2000 hours or 8 p.m. So you have that on screen for you. As a recap for, may I stress, for Bangkok and surrounding provinces, totaling 6 provinces. The times, please note the times that you have on screen. For example, the closure of restaurants at 8 p.m., 2000 hours, as well as the closure of public transportation services from 9 p.m. or 2000 hours. I have to emphasize this because the information that was released prior to this briefing had different inaccurate times. In addition, all government departments are requested to work from home at the maximum capacity, and the CCSA would like to ask the private sector, businesses as well, to similarly apply this work from home scheme at the maximum capacity as well. Now that was for the 6 provinces, Bangkok and 6 provinces. Now I'll move to the dark red zone, which includes all 10 provinces, meaning Bangkok and the surrounding provinces, as well as the 4 southernmost provinces mentioned. So this is for all 10 provinces. What I'll say now is for all 10 provinces in the dark red zone. Firstly, of course, avoid making unnecessary travel trips. The public is also asked to stay at home from 2100 hours to 0400 hours. So that's 9 p.m. until 4 a.m. in the morning. And leave your residence only for important reasons, for essential purposes. Also, the prohibition of gathering of not more than 5 people, with the exception of certain cultural events such as funerals. So this is for all 10 provinces in the dark red zone. Please note the second line that you see on screen, that's very important. Stay at home from 2100 to 0400 hours. I'd like to move on to interprovincial travel. Interprovincial travel, companies will be, on this, public transportation companies will be asked to reduce their service. And relevant authorities will impose stricter restrictions on interprovincial travel, especially from 10 provinces in the dark red zone, including quarantine measures at the destination to minimize the movement of people, and checkpoints along the way from, if you're traveling from the dark red zone to other provinces. Checkpoints will be something that you'll be meeting. So checkpoints set up by police and other personnel starting tomorrow, Saturday, the 10th of July. So that's basically the recap of the new measures. It's very important to deliver this in a clear manner because there had been a lot of news agencies, as mentioned, releasing news which is not confirmed yet, even before the general CCSA meeting had already before it was even finished. I'd like to move on to the vaccination issue that was mentioned by Dr. Apisamai as well. So at the moment, the government's priority is the inoculation of adults aged, senior citizens aged 60 and over, and people living with 7 underlying conditions. This is to reduce the deaths and severe cases, in which over 75% of deaths and severe cases are people among this group. The CCSA has approved the plan to distribute 80% of vaccines supply in July to allocate to people in Bangkok, with priority of adults aged 60 and over and people living with the 7 underlying conditions. The related resources and manpower will be allocated to support this operation in order to save lives of your beloved ones. Now, regarding vaccines that Thailand received from our friends from abroad, the Ministry of Public Health proposed the distribution plan for this part as follows. Vaccines from the US would be allocated to, number 1, medical personnel and health workers directly related to COVID work as a booster dose. Number 2, adults aged 60 and people living with 7 underlying conditions. Number 3, foreign nationals in Thailand, elderly people with conditions as the priority in the foreign nationals group. And number 4, those who need to get the vaccines before going abroad, such as students, athletes, and diplomatic personnel. So these are the allocation plans for the vaccine received from the United States. Now, the vaccines received from Japan, which is 1.05 million doses of AstraZeneca, this will be allocated to, number 1, adults aged over 60 and people living with 7 underlying conditions. Number 2, foreign nationals in Thailand, especially elders and people with conditions as the priority for this group of foreign nationals in Thailand. And number 3, those who have the necessity to get vaccinated before going abroad. So it's quite similar in terms of the grouping for the vaccines that have been provided by the United States and Japan. In terms of testing, the CCSA has discussed about the usage of the rapid antigen test, as the regulation is required to be amended before the public can use the antigen test kit. The Health Ministry will further discuss with relevant agencies before issuing a guideline for the public, especially expecting to be finalized by Monday. And moreover, the new COVID-19 testing sites will be opened at the Thai-Japanese Stadium, the Homak Stadium, the Tupatemi Stadium for walk-in service, and the operation time for the testing sites will be announced by the Health Ministry and the Bangkok Metropolitan Administration soon. I'd just like to go back to the restrictions for the 6 provinces that was mentioned just now, just to recap, because there is a lot of information here, and especially in the timing of each of the schemes as well. So I'd just like to repeat, just briefly, in case I made any minor mistakes. So for the 6 provinces, namely Bangkok, Nonthaburi, Pathum Thani, Nakhon Pathom, Samut Prakan, and Samut Sakhon, from the 12th of July, Monday, we'll have the closure of shopping centers with the exceptions of some stores in shopping centers, such as supermarkets, takeout restaurants, banks, and financial institutions. Standalone restaurants, markets, convenience stores will be closed at 8 p.m. and may resume service at 4 a.m. Public transportation service will be seized at 9 p.m. and will resume service at 4 a.m. I might have made a minor mistake there, so just like to repeat that public transportation will cease service at 9 p.m. in these 6 provinces and resume service at 4 a.m. Spas, beauty centers, and massage parlors will also be closed, while public parks will be closed at 8 p.m. So that's very important for the residents, for the people living in Bangkok, as well as the 6 provinces. And there you have that on screen for you, just to recap again. Just to note for one last time, restaurants closing at 8 p.m., public transportation ceasing operations at 9 p.m. and starting again at 4 a.m. in the morning. So just to express just a short apology to the general public for the inconvenience that some of these new measures might be causing to you. But of course, we have to work according to the situation. We have to continue to press on the very important measures that are necessary for this day. I mean, each day counts, each minute counts. We seek your understanding that the government, the CCSA, needs to convey that control of the current situation is for you, and all the measures and everything that we do, all the adjustments, all the analysis, all the thoughts, all the work that we do every single day is for you and for the public safety as well. So I guess that in the coming days we might have a slight change in the briefing. We'll confirm to you if there is any change in the briefing because of the important changes that we have in the messaging that we must make every day. So just one last note is that with that note, I thank you for your attention. We might have some changes as mentioned in the briefing, in the messaging, according to the situation, hoping that we will not be reaching high numbers of infections in the next week. Most likely that will happen, but hoping that it will not be prolonged, hoping that will not be an extended situation. Meanwhile, please continue to understand the measures that we have put in place. Please follow the measures very strictly. It's all for you. We hope that this will not last forever. So thank you very much for your kind attention, and we'll see you again next time. Sawadee krap.